Kalimera. And for those of you joining remotely from around the world, I understand we have just under 8,500 people participating in several countries around the world. Good morning, good afternoon, and good evening to all of you. I am very pleased and honored to welcome you to the third annual meeting, Greece's Agenda to Combat Cancer. As evidenced by your presence here today and your presence online, we are not complacent. Indeed, there is no time for complacency when facing a diagnosis of cancer. We are all touched by this disease, whether directly or indirectly, because cancer touches all of us in some way. Please join me in thanking the Hellenic Society of Medical Oncology and MSD for supporting our conference today. Today's conference builds upon the recognition that we must address the challenges and inequities that the COVID-19 pandemic has underscored. Prior to 2020, cancer survival rates showed signs of improvement thanks to improved screening and earlier detection. During the past 3 years, the pandemic has highlighted disparities while causing interruptions in screening, disrupting detection and diagnosis, and delaying treatment. We are committed to redoubling our efforts to address the challenges posed by cancer and maximize the opportunities emerging from new developments in prevention, screening, early detection, and treatment. We have innumerable opportunities to improve the care we deliver in order to improve outcomes. Working together, we can improve our communication, develop and strengthen ways to collaborate, build consensus together, and thereby reinforce the resilience of our approaches and systems to address cancer. We must not waver. Our attention cannot waver. This conference is important, and it's important to have it annually because it provides us with an opportunity to evaluate our progress towards meeting the goals of Europe's Beating Cancer Plan. Our focus cannot waver. The global incidence of cancer is increasing. In 2020, there were 19.3 million new cases of cancer worldwide, an increase from 14 million new cases in 2012. Worldwide, 1 in 5 people will receive a diagnosis of cancer in their lifetime. Globally, the most common cancers are those of the breast, lung, colon, rectum, and prostate. Our commitment cannot waver. Meeting each year, we reaffirm our dedication to build more equitable and resilient approaches as we work to achieve the European Cancer Concord's goal for long-term cancer survival rates of 70% by 2035 and doubling survival for intermediate and poor prognosis cancers. In 2023, governments have started to downscale the range of programs and emergency response efforts put in place to address the COVID-19 pandemic. Call centers, immunization clinics, and programs are being dismantled following the suspension of pre-flight testing to many destinations in 2022. Instead of merely disassembling what had been innovative outreach programs to address the unprecedented impact of this public health emergency had on societies, we must find ways of retooling and adapting these programs to address our next public health emergency, the pandemic caused by cancer. An observation made by experts at Johns Hopkins Coronavirus Resource Center strikes a real chord for me as it gets to the heart of the mission of public health and health policy. If we have to wait for people to get sick to figure out where to target government outreach, it's too late. Our single-minded concentration on combating cancer cannot waver. Today, we will discuss 7 unifying themes. The first is promoting prevention is self-empowering. Between 30 and 50% of cancers are preventable. There is a role we can all play in preventing cancer. Make health-affirming decisions. WHO has called the tobacco pandemic one of the most significant challenges to global public health. Tobacco is recognized as the most important risk factor for all cancers, responsible not only for 85% of lung cancer cases, but approximately 22% of all cancers. Europe has the highest percentage of smokers worldwide. An estimated 209 million Europeans smoke, and of these, half are estimated to die prematurely as a result. Strengthening anti-tobacco legislation must be a first step. Innovations to prevent and treat cancer are making good strides. Indeed, mRNA technology that proved so successful in vaccines for COVID-19 had its origins in oncological research. The HPV and hepatitis B vaccines are seeing more widespread use around the world. HPV infection causes over 95% of all cases of cervical cancer. HPV vaccination can prevent over 27,000 cervical cancer cases annually. In addition to reducing cases of hepatitis B, increasing the uptake of hepatitis B vaccination can help to reduce the number of cases of liver cancer. Research continues as we look for ways to reduce and prevent the ever-growing incidence of cancer globally. Our second theme, reinvigorating the focus on screening, improves early detection. The single most powerful lever in saving lives is early cancer detection. By now, we know the terrible impact the COVID-19 pandemic has had on cancer screening. Startling statistics were discussed at last year's conference. In Greece, the number of cancer screenings plummeted 90% during the pandemic. We are at the cusp of understanding the impact this will have on cancer diagnoses and survival. The European Cancer Organization has predicted that the pandemic will be the cause of 1 million missed cases of cancer diagnoses in Europe. But simply catching up to pre-pandemic levels of screening is not sufficient. Beyond initiatives to reinvigorate screening programs is the need to improve screening among underserved populations. Our third theme is reducing inequalities in access to screening, diagnosis, and treatment must be accomplished. Lack of access to screening and early detection delays diagnosis, thus prolonging the initiation of treatment. In late 2020, the British Medical Journal reported that a 1-month delay in cancer treatment, can increase a person's risk of mortality by approximately 10%. Beyond the individual challenges confronting people living with cancer are the wider access challenges for getting innovations to them. We need improved policies to support systems that ensure sustainable and equitable access. New innovations offer great promise, but stakeholders, HTA authorities, and government decision makers need to prioritize their efforts to get them to people who need them. Recognition that obstacles to improving cancer care and access to treatment is not limited to financial barriers is our fourth theme. The link between poor access to care and poor health outcomes is well established. Non-financial barriers prevent people from access to healthcare services, and these include geography, language, fear and distrust of health providers, and difficulties getting through appointment or gatekeeper systems. The cancer care system is complex. Consequently, various barriers that limit or complicate access may surface at any phase of care. Once initial hurdles have been overcome, additional barriers may arise when attempting to navigate complex health systems. The literal and figurative steps for getting from a primary care provider to a specialist may perplex people who are dealing with their cancer diagnosis, as well as health professionals. Incorporating the latest knowledge and technologies into clinical guidelines and cancer care pathways can help to guide health professionals to achieve better outcomes through improved recognition and treatment. Our fifth theme, utilizing advancements in digital technology, can improve cancer management. Technological innovations must be carefully integrated into health systems in ways that address the needs of patients and health professionals. Health informatics systems, including telehealth, mobile apps, electronic medical records, and telementoring, build upon advancements we've all witnessed in digital, artificial, and virtual technologies. They can improve the delivery of cancer care by improving real-time feedback and diagnostics, helping to reduce delays in treatment while improving patient engagement. But incorporation of these tools is dependent upon a reliable digital infrastructure for telecommunications and internet services that are accessible in the most remote areas at costs that are not prohibited for either individuals or health systems. Beyond the physical infrastructure, improvements in digital literacy skills is needed to enable effective utilization of computers and smartphones across the population. Implementation plans must focus on overcoming inequitable access while not further exacerbating existing inequities. Our fifth theme, destigmatizing cancer, must be achieved while ensuring people living with cancer are heard by decision makers. Stigma subsists on a lack of understanding and fear. Its impact goes beyond an emotional toll. Minimizing stigma can be achieved by providing the general population with information based on evidence and myth-busting. We need to improve how we engage with people living with cancer, ensuring that their needs are heard by decision makers because improvements are needed in all aspects of a person's journey with cancer. Awareness, prevention, and health literacy campaigns can contribute to public health outreach by empowering people through knowledge, including people living with cancer in the development of clinical guidelines and treatment plans, can help to solidify their role in the decision-making process and give voice to what they are experiencing because they are the ones living through their treatment. As clinicians, we must be there to help, support, and listen. We must work to destigmatize cancer through education, awareness, and compassion. Stigma is real and corrosive. It can delay diagnosis and leads to unnecessary suffering. Finding solutions to address stigma ensure that people receive the psychological, supportive, and palliative care they need to navigate their journey with cancer, and this is vital. Our seventh theme is building more resilient future, ensuring that cancer is a priority. The cost of inaction, both to individual lives and the sustainability of health systems, is too high to ignore. The pandemic has renewed our recognition of ethnic and racial inequities, focusing our awareness on how new and existing technologies can be utilized to eliminate barriers and achieve health equity. The partnerships that have been forged and strengthened during the pandemic must be extended to ensure that we prioritize the resilience and sustainability of health systems to ensure that barriers to information, prevention, screening, early detection, and treatment become sad remnants of our past because they have no place in our future. Cancer must be a priority at the top of every country's agenda. We must build more resilient approaches, redouble our efforts to address the challenges posed by cancer, and maximize the opportunities emerging from new developments in prevention, screening, early detection, and treatment. Cancer touches all of us. Improving our communication, developing and strengthening ways to collaborate, building consensus together. We can build a better future because there is no time for complacency. We must not waver. Efaristo.